What's up, evolutionaries? It's your boy Callie, and I'm back again with another video. If this is your first time tuning into my YouTube channel, welcome to the evolution. And if you are a returning viewer, as always, thank you so much for being here to show your support for the evolutionary life of Callie and all its movements. Today's video is the third chapter in the 17 Sustainable Development Goals series that I started about 2 or 3 chapters ago. The first video was about an introduction of what the 17 Sustainable Development Goals are. The second chapter focused on the first goal, which was no poverty. The third chapter spoke about the second goal, which was zero hunger. And now the fourth video, or the fourth chapter, speaks about goal number 3, good health and well-being. Don't get confused. It's chapter 15 of the overall evolutionary life of Callie, but it's the third or the fourth chapter in the 17 Sustainable Development Goals series, just to clear that up. You guys may notice that I have changed my background. I decided to open the curtains since there's no sun. Usually I do my videos, there would be a lot of sun in the background, so I would close the curtains. But this evening the sun has gone down and it's pretty dark outside because there's a tropical wave passing through Jamaica, so we decided to open the curtains for you guys today. But let's get into the video. As always, the video will be split into 3 parts. The first part will speak about an overview of what good health and well-being refers to. The second section will speak about the 3 main targets, and the third section will focus on progress and information. Let's get right into it. What does good health and well-being refer to? Good health and well-being refers to the state of being vigorous and free from bodily or mental disease, a state in which you are able to function normally and without pain, being comfortable and happy. In its entirety, that's basically saying if you are physically and mentally great, you have no sicknesses, no diseases, whether it's a mental disease or physical, doesn't matter, then you are classified as having good health and well-being. The opposite is just when you're sick, or you have mental illnesses or anything that threatens your body or your life, then that is considered not having good health and well-being. As with any other goal, the tagline for good health and well-being states, ensure healthy lives and promote well-being for all at all ages. Pretty simple. Important facts to note. There are 3, as always. The first one says, COVID-19 is the most deadly virus of the 21st century that threatens good health and well-being. As you know, COVID-19 started in late 2019, early 2020, if I'm correct. And since then, I haven't seen any other illnesses that's going around that is as deadly as this. So that's why I labeled that as the first important fact. The second one is that COVID-19 again has halted or reversed progress in health and has also shortened the life expectancy. As mentioned in the previous 2 chapters, which were no poverty and zero hunger, COVID-19 has also affected the progress that the United Nations has made in eradicating both of those goals, and it's no different that the same is affected as it relates to health and well-being. The third top important factor would be that health workers are in short supply in many regions. They have been stretched to their limits on account of COVID-19 again. So health workers, nurses, doctors, once you work in the health sector, in most regions, or in many regions, they are stretched thin. There's not many nurses or doctors to go around, and so they have reached their limits, and so COVID-19 is the cause of all that. And that sums up the first section of today's video, the overview of good health and well-being. Let's move on to the second. I don't know which way to point. Let's move on to the second section, which are the 3 main targets that the United Nations have to eradicate good health and well-being. Let's get to it. The second section of today's video will be speaking about the three main targets that the United Nations have to reach good health and well-being, or to achieve good health and well-being. The first target 3.1, states that by 2030, reduce the global maternal mortality ratio to less than 70 per 100,000 live births. The second target 3.2, states that by 2030, end preventable deaths of newborns and children under 5 years of age, with all countries aiming to reduce neonatal mortality to at least as low as 12 per 1,000 live births, and under 5 mortality to at least as low as 25 per 1,000 live births. That's a lot of math. The third target is target 3.3, and it states again, by 2030, end the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases, and combat hepatitis, waterborne diseases, and other communicable diseases. And that sums up the three main targets that the United Nations have to achieve good health and well-being. Let's move on to the final section of today's video, progress and information. The third and final section of today's video will be speaking on the progress that the United Nations has made in accomplishing or achieving good health and well-being. It will also be speaking about additional information that you may or may not need, but let's put it out there. As mentioned before in the other videos, I'm not able to read everything, so I took some notes. However, at the end of the video, you can check out the link below in the description, and it will lead you to the full page to have all this information at your fingertips. So let's get started. Before the COVID-19 pandemic, progress had been made in many health areas, including improving the health of mothers and children, increasing immunization coverage, and reducing the incidence of communicable diseases, albeit not fast enough to meet the Goal 3 targets by 2030. Disruption caused by the pandemic has now halted progress and even reversed some gains made, as mentioned in one of the important facts. Reproductive, maternal, and child health. According to data from the period 2014 to 2020, 83% of births worldwide were assisted by skilled health professionals, including medical doctors, nurses, and midwives, and increased from 71% in the period of 2007 to 2013. The COVID-19 pandemic may reverse gains in skilled childbirth care coverage and disrupt maternity health services. Infectious diseases. While the rate of new HIV infections declined from 0.48 infections per 1,000 uninfected population among adults to 0.37% 1,000 between 2010 and 2019, it remained far higher than the global target for 2020. The largest decrease was in sub-Saharan Africa, the region with the highest numbers of people living with HIV. Non-communicable diseases, mental health, and environmental risks. Globally, 74% of all deaths in 2019 were caused by non-communicable diseases. The probability of dying from any of the 4 main non-communicable diseases, which are cardiovascular disease, cancer, diabetes, or chronic respiratory disease, between 30 and 70 years of age decreased from 19.9% in 2010 to 17.8% in 2019. The rate of decline is insufficient to meet the global target. The COVID-19 pandemic has underscored the need for further attention to interventions in non-communicable diseases, as people with underlying non-communicable diseases are at a higher risk of severe illness and death from the COVID-19 virus. Health systems and funding. Immunization is one of the world's most successful and cost-effective health interventions. While vaccination coverage among infants increased from 72% in 2000 in 2000, yes, 2000, to 85% in 2015 before stalling until 2019. An estimated 19.7 million children did not receive essential vaccines during the first year of their life in 2019. Health workers are on the front line of the COVID-19 pandemic response. Countries and territories, especially those with a limited health workforce, are further constrained with regard to the delivery of essential health services. The density of medical doctors in North America, Oceania, and Central Asia remains around 25 per 10,000 population compared to 2 per 10,000 population in sub-Saharan Africa. And that sums up the progress that the United Nations has made in accomplishing or achieving good health and well-being, and also additional information that was mentioned. And that's the end of today's video. Thank you guys for being here. It means a lot to me. This 1 week transition has not been easy. I now have to just to catch you guys up on what's been happening, or should I leave that for another video? No, let's leave that for another video. You know, let's pique your interest in what I was about to say. So let's wrap up today's video. Thank you guys for tuning in. It was my pleasure being here again, as always, to provide you with the necessary information you need to stay educated and to educate others. Don't forget to leave a like, share, and leave a comment about how you feel about these series that I've been doing, and any other suggestions that you might want to give. Also, don't forget to subscribe. Remember, one more subscriber equals one more supporter against all the human rights infringements, and as of 3 videos ago, the 17 Sustainable Development Goals, or rather the achievement of these 17 Sustainable Development Goals. Thank you so much for being here. As always, see you next week. Callie is signing out. Bye, guys.